Hi, everyone. My name is Lanique Cross. I am honored to be here today speaking about the hidden crisis and its effects on senior health, and that hidden crisis is loneliness. I come from a background of healthcare education, and currently I work for RxSense, a innovative healthcare technology SaaS provider. I'm joined today by a distinguished a group of experts who bring a wealth of knowledge and passion to this discussion. So let me take a moment to introduce the panelists. On my far left here, I have Loretta Doga, RNBN, who is a nurse psychotherapist and founder of You Matter Care, an organization that focuses on supporting individuals with addiction through recovery and comprehensive mental health services. Next to her, I have Dr. Christopher Rouse, PhD, LMHC, who is the CEO and owner of Evolve Care Counseling. Evolve Care Counseling is an organization that specializes in accessible, empathetic mental health support with a unique approach influenced by Dr. Rouse's interest in gaming and comic book communities, allowing him to connect with patients through a shared passion. Next to him, I have Dr. Jemima Crescentia, who is the head of medical coding and audit at Cure Medical Centers. And Dr. Crescentia is committed to promoting health education and community awareness through her organization's initiatives. Right next to her, I have Renita Bolt, the CEO and founder of Caring with Compassion Community, an organization that provides a holistic approach to support individuals with disabilities, mental health concerns, and they offer essential resources to enhance life skills, careers, and community integration. And finally, I have Dr. Lillian Alevato, who is the Chief Medical Officer at White Wilson Medical Center in Fort Walton Beach, Florida. Dr. Alevato specializes in value-based care, focusing on improving patient outcomes while managing costs, and have a lifelong dedication to quality patient care and clinical experience. So, opening up the discussion, I want to talk a little bit about loneliness and its context of senior health and how it differs from social isolation. So, loneliness in the context of senior health is different from social isolation. Loneliness is a subjective emotional state. It is a feeling of being alone or lacking meaningful social connections, regardless of how many people you are physically present around. A senior can be surrounded by family, caregivers, yet still feel loneliness. And with loneliness, they experience deep disconnection, regardless of interactions. Social isolation, on the other hand, is an objective condition. It refers to a lack of social contact and engagement, and a senior who lives alone and rarely interacts with others is socially isolated, but not necessarily lonely if they're comfortable with solitude. The key difference is that social isolation is about the quantity of social interactions, while loneliness is about the quality of those interactions. Both can negatively impact a senior's mental and physical health, but loneliness in particular is strongly linked to emotional distress and increased risk of depression, cognitive decline, and other serious health concerns. So let's open up this discussion. First, I'm going to call on Dr. Crescentia. So tell us a little bit about your stance on loneliness as it relates to senior health. And also, can you discuss with us some of the most significant physical, mental, and emotional health effects of loneliness among older adults?
Sure. So, good evening to all. First of all, we should know this old age group, we all know, but still, the age group is 60 to 65. So by this time, people basically become like tired. They become like tired of everything, and even they want to quit from whatever they want doing. But at this stage, we have to give more attention and more activities to them, and we have to engage them in our regular conversation and communications. If not, automatically they feel the loneliness, and the loneliness might be due to any reason, like due to the death of due to their retirements, or due to death of their loved ones, or due to their physical disability, whatever may be. But finally, the result will be the same. So as she's mentioned, for sure, this loneliness obviously leads to physical, mental, and emotional weakness among the old age peoples. So first of all, let me talk about the mental disability or mental weakness, which is caused due to loneliness. If you see, like we all know, whenever people stay alone for a long time, automatically it leads to increased cortisol level. You know that increased cortisol level automatically push you to the depression, anxiety, and mental instability. So this is one of the mental weakness or mental illness which is caused due to loneliness. The second thing is physical weakness. So when some old age adults, due to the loneliness, they feel that they are depressed or they are having anxiety or panic attacks or whatever may be, they obviously start eating less, and their motility rate decreases, their movements decreases. So basically, because of that, their immunity levels goes down, and they are prone to infections, and they are prone to arthritis. So they are prone to many diseases. So physically, they are also affected because of their mental weakness and mental illness. Next comes the emotional weakness or emotional illness. So whenever like a senior person, old age people, when they feel alone, they started thinking that they are worthless. Means like they lose the interest what they were doing. Like they were actually involved in many activities previously. Maybe routinely they are involving in some community activities, some mental coaching classes or whatever maybe. When they are alone, and when they feel that they are loneliness, they started losing interest in everything. Even they start losing interest to talking to a nearby and their loved ones. So that is the main thing, and they lose their cognitive behaviors. So they start losing everything. Even they have memory losses, they have dementias, they started having Alzheimer's. So all these stuffs automatically comes in because of the loneliness. So obviously it is our responsibility to take care our old age adults, or not pushed into this loneliness or the crisis which is caused because of this loneliness. So I hope all of our panelists will be discussing further like how to avoid these crises in old age adult loneliness status. Thank you.
Absolutely. Thank you very much, Dr. Crescentia. As we know, research has shown that loneliness has just a severe risk factor as obesity or smoking. So we definitely need to pay just as much attention as we do other severe health factors. Next question is for Ms. Loretta Doga. So also, can you tell us your viewpoint on senior loneliness? And also, what do you believe are the primary factors that contribute to loneliness in seniors? And how do life transitions like retirement, loss of loved ones, or even health play a decline?
Thank you, first of all, for being here and having me here. I am very passionate about mental health in general. However, as a nurse, during my career, I have noticed since early age that elderly do feel isolated for different reasons. And those are very common. We may not think about these reasons in everyday life. However, are simple things that create that loneliness, which then makes for the isolation. Moving to a retirement home, it is the end solution for a lot of families. That where I have been working and I have been in contact with a lot of elderly and family members who do find difficulties in that transition from home to long-term care. However, there is many different reasons why they do feel isolated to move in to long-term care. It is also loss of trust. They feel like they are not worth anymore. They are betrayed. They left alone. Definitely, we know that a lot of family members have to work, and these days, at least in Canada, everybody has to work and extend hours. Therefore, there is not a lot of time to go and visit them. The visits are very short, right? So that is one of the reasons why they do feel abandoned. Also, feeling abandoned does make them feel lonely, separated from the family, right? Which also impacts their activity level, the engagement with other people in the same facility, and sometimes that loneliness can also, as my previous colleague said, brings to health issues, mental health issues, right? So we do see a lot of changes in behavior, we do see aggressiveness, and we do understand that that can bring also to a depressive mode, right? Also, getting to understand that our medical system is going down. That's a fact. We have a lot of nurses that are leaving. We have a lot of PSWs that have to work extra hours, extended hours. They are drained because of their not well performance. Now the impact comes in the elderly. So their health, it's something that we have seen as now they live their lives and let's move on. We can give medications. We do check the blood pressures and the blood sugars, but it only takes 5 minutes, literally, to have that attitude to talk to this elderly person on the other side and ask, how are they doing? How was their day? How did they sleep? If they're angry, pissed, right? If they're missing anything, is there anything I can do for you? And that's what I've noticed in a long-term care that is creating that, right? Isolation. I don't feel appreciated. I don't feel that I'm worth it. I'm valued, right? Do not forget also, another cause of loneliness, it is also because economical strains, elderly tend to please the younger generation, their kids. They love to take as much away of burden from them. Therefore, they don't want to burden their young children, right? Young, whatever. I'm not young, but they're younger kids, right? The younger generation. Due to they have jobs to take care, they have kids, they have finances, they have mortgages to pay, so it's a lot of issues. The last thing that a parent at a certain age wants, it's definitely to make their children suffer on top of that. And because of that, they tend to keep their feelings for themselves. Therefore, they will not say how they feel. If they are asked if they're okay, they will just brush it off. Yes, I'm okay. I'll be fine. You don't worry about me. However, loneliness, as it was explained by Lenique in the beginning, it's not something that we can easily spot. That's the problem, right? We expect elderly to say something instead of us analyzing and observing how they're feeling, what they're doing, are they okay, why they're not doing certain things. And not all the time it is because they're isolated or because they're feeling lonely. It could be that that's a coping mechanism as well, right? So we have to be very attentive to what we call loneliness and what could be a coping strategy for that person. Level of energy, we talked about the physical impact and everything coming at that age. Also, loss of comfort and familiarity. It's another thing. We know that the older generation has worked as hard as it can be. We think we have it hard, they had it much harder. We have it much easier because we have the means, we have the technology, we have access to a lot of things. The older generation, they couldn't. So they had to build everything from practically zero. We were given something to bring on, they didn't. So for them to move from their home, which they built, and it was the dream, they have the memories, they have their shops, the hairdresser that they go to, they have the next neighbor that they share, or they compete in the garden, who has the better garden, right? So leaving all of those things and going to a long-term facility where practically you're directed on what to do, that also causes them to isolate themselves, to be alone. I don't belong here, right? Another thing, which is different from this point, it is exactly how are we building the nursing homes? In what perspective? Mostly, it's medical care. And that is the biggest issue that I have seen, at least where I am, where I worked in Toronto. I don't know how it works in America, but it is a big issue. Skill, skill, skill. You apply, 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 and you get into the routine of just performing instead of stopping, thinking, analyzing, and appreciating the other person for what they are. They are knowledge, they are experience. They have a lot to teach us, right? And as I said, it takes 2 minutes to just ask a question, and that question will answer a lot of your questions. You will know how to approach. You will know exactly how to assess and how to intervene, which that's what we need to do.
Awesome, thank you. You made a very good point about societal view on ageism, right? Too often our seniors feel as if they're not being acknowledged, right? And that too can also severely deepen the feeling of loneliness. Very great discussion. Dr. Rouse, my next question is for you. So again, tell us your viewpoint on loneliness and its impact on senior health. And also, can you discuss the steps that healthcare professionals and organizations can take to better identify and address loneliness in senior patients?
Well, thank you for the question. Again, thank you for having me as a panelist on here. I'm really honored. When I think about how we approach things in America, it's more like a multi-pronged approach. Assessment, looking at what are the local resources for individuals, especially the elderly, going through isolation, working on different type of mental health type of paradigms that really attack the negative cognitions that go along with being alone. It's been beautifully recited by everyone here. It's just that they feel they're not worth it. They're alone. No one cares anymore. And for an individual that is growing up, even at that stage of life, it's disheartening. I had a internship at the Province Regional Cancer Partnership, And a lot of individuals I was helping with, they were struggling with loneliness. They were struggling with cancer treatment. And a lot of them were going through kidney dialysis. And for a lot of them, there was no one else with them. So I incorporated using a mind-body interaction using Tai Chi with movement, working together with proper breathing, meditation, a different perspective of how to view the world. And that started to build a small community within all the other patients. And slowly they started coming in. I sadly was not able to carry on with it because I had to work on other stuff for graduate school, which is, how that goes. But the next layer that goes on to it, the fourth component, is looking at different type of policies that we can integrate into our culture that normalizes the stigmas that go along with aging, isolation, and moving forward from there to give these individuals the dignity and the companionship that they deserve. I know that different projects in America have been instrumental in this. The Boston Medical Center has this program that adapted the Thrive model, and within that model, they're able to identify individuals. Usually the gold standard when doing assessments for this would be the UCLA loneliness scale. It's a 20-item, but thankfully there is a shorter one, just 3. Because you don't want to stay there forever. But then going from there, once the system is flagged, the next part would come into play of finding resources within the community that would help and be as seamlessly as possible to allow an easy transition to go together with different individuals that would help them. So, different type of social support, different types of social skills. I know AmeriCorps has their own project with seniors that helps incorporate ways to help individuals that don't have mobility. So, such a nice program. It helps the elderly find someone else to talk to, companionship. So a lot of the themes that comes together is finding the opportunity to interact with another individual. When I was a kid, we used to have a lot of the community members that from local churches or that would come over and help the younger generation, just to help bridge that gap. And in that moment, it's magical, because you get a lot of individuals that see, there's such wealth of wisdom, care, love. And sadly, I feel like with the grouping of different forms of technology we have now, it's starting to separate itself. I had a patient that was really brilliant about this, and he, I know I'm going to butcher it, paraphrasing him, but he said, when I look at my grandparents' generation, they observed the internet. My parents, they lived alongside the internet. My generation, we live in the internet. So think about all those different barriers in the way. And, what I want to help achieve is a better way to build a better connectivity with everybody else. So.
Absolutely. Thank you very much for that insight. Even AARP online for our tech-savvy seniors has a loneliness assessment. And, healthcare professionals can even integrate simple questions within your wellness checks that it doesn't have to necessarily be difficult, but can go a long way in early intervention. So the small things matter.
The small things matter, yeah.
All right. Thank you so much for that. My next question is going to go to Ronita Bolt. So again, tell us your viewpoint on loneliness and how it affects senior health. And the question is, how do you think healthcare systems can incorporate social well-being into patient care, and what policy changes would support this integration?
Thank you guys for having me here. This is my 3rd invite here, and I appreciate it. So I want to go and share a story how our organization formed, Caring with Compassion Community. We had a community member in the neighborhood who was going around knocking on doors in my neighborhood, telling everybody about Jesus Christ. And he knocked on my door. I'm a believer. But he was, I think, 81 at the time, and he was taking care of his wife that was 80 years old. And he went on to share with me that his wife had fallen, had hip surgery and everything, but they were not connected to any resources. So that was my line of work, and I had just got fired from a managed care organization I was working at. So he came and talked to me, and he said, why don't you take a walk with me in the community? And he was letting me see all these neighbors he had been talking to. And so from there, I began to connect him to different community resources. At first, he was hesitant because he was like, that's the welfare system and this and that. I was like, no, that's your tax dollars. And so I plugged him in. And so we started making the connection. He's a retired Air Force. He's a retired pastor. And he had all these skill sets that he had a routine of jumping rope every day. He even made the ropes. He had a diet routine. He played banjo, built banjos, and he played the keyboard. And he lived in a 55-plus community that he shared with me. A lot of people were getting placed into nursing homes by their families because their kids lived away. They didn't want to leave, and he tried to have me come in there and share the resources, but they didn't need it. So they said. But long story short, we lost contact for a while, and his wife had passed right before COVID. We were still in contact and stuff. And so he was going through a grieving season, and it was right around Thanksgiving time. We invited him over for Thanksgiving dinner, played the banjo, had another neighbor come by, and that's when we lost a little contact. But a year or two later, he came knocking on my door, letting me know he needed, some assistance and stuff. And when I saw him, he looked so frail. He shrunk. So I saw the impact physically. I'm like, wow, you look so small. I'm saying that to myself. So I immediately brought him a bag of groceries because he hadn't been eating. So the loneliness of losing his wife, his income went down. He was concerned about how he's going to take care of his house. Another community member with our organization lived in an adult family home, and he didn't feel he fit there, but he had his brother who was younger than him, and his mom wanted him away in an adult family home. He was 61 years old. And the adult family home had seniors and stuff his age, but they were physically and low functioning. And he felt he wanted to be in his own apartment, get his job. So he called our organization. He got his number from his mental health provider, his peer specialist. And he called me directly and said, I need help getting a job and getting my apartment so I can live in my apartment. And I know I'm going to need some help, but I need this. Light bulb went off in my head. I connected him to that senior who needed a roommate. And when I connected them together and they finally met, they knew each other. They had gone to the same church. So long story short, they made a connection. We found the guy a job. This older gentleman was 85 now. The younger gentleman was 61. So he got companionship, and he said, this is like a son I never had. So I say that's a success story. And we also helped the younger gentleman reach out to an advocacy group. So when you talk about policy change, because his brother was didn't want him to leave, trying to control him. He didn't have guardianship or anything like that. So we were telling the young guy, you don't have to listen to him. If this is what you want to do, you're advocating for yourself. We can plug you into Disability Rights Washington. That's an advocacy agency for all populations, mental health, seniors, and everything that's in Washington State where I'm located. And so we set him up to talk to their counselors so they could provide him some support. We also started providing resources about navigating our legislative session, making changes in the system. And we know the adult family homes, they now, I think it was about 5 years ago, something like that, they now have to implement in their adult family homes, give the residents in their options and choices on what they would like to do. Because at this particular adult family home, it was way back in the woods, away from community. You had to, and transportation didn't go out there, and they didn't provide them transportation to connect with their community. And the young guy who was in that home, he lived in the city, but his family wanted him to be placed farther out and stuff. So it was just something that I was not aware of until I got fired from my job. I connected with the older senior, and we started talking, and he showed me around in my community what was happening with the neighbors and things like that. Resources was missing, and long story short, that led me to the other young guy for us providing services to him. So community connection is a big thing, and policy changes, it starts with the community and being aware of what's happening in your neighborhood and connecting, being a connector and connecting to your community, and especially checking on the seniors in your community, making sure they're okay, especially with COVID and things like that. Do they have food? Do they need assistance to go to the grocery store? Do you need me to cut your grass, or just come sit with you and companion with you? I don't know if that was all a question, but I wanted to share that story because I see that person came and boldly knocked on my door to share the gospel, and that led to us. He was connecting, but it led to much more that was provided for him. So that's how our agency got started, because of that.
Awesome. Thank you so much for sharing. We know that healthcare is not just about addressing symptoms, right? It's about addressing the whole person. So societal interventions like that goes a long way. Dr. Crescentia?
Some points to add to her comments, actually. So she mentions about the policies, right? So I think United States have a lot of policies involved, and like Dr. Christos mentioned it. So we have Papa Pal program, like where they need assistance. The young people come to your home, the old age senior home, they help with them from cooking, gardening, and they give companionship for them. So this is a paid program, basically, and some of like Medicare program it covered, I think. But I can suggest, and we have one more program called Time Back. Actually, we were discussing all that. So what does this time back means? Like if young people come to an old senior and they were supporting with all this domestic work or companionship, so these time is stored in their bank, like in their name. So when they grow old, they are provided with these kind of services for free. So it's a good option we can actually opt. And very importantly, again, not even the policy, the family relationship. So from a country where, like India, for sure, we don't have much of old age homes. I'm proud to say that. And we don't have much of loneliness or crisis. The only reason is the family is connected. So wherever you go, wherever you see, the families look for each other, they care for each other. And also the families, they consider that older seniors as a blessing. And they don't leave them idle at home. Actually, we were discussing during the panel discussions also, they involve them in all their conversations, in all their daily activities, and very importantly, they were given the best part of their life. As my colleague said, they love to be with their grandsons, like granddaughters, right? So they are given the responsibility to take care of their grandchildren. So that is the greater responsibility. So they become connected, they become active, they never feel the loneliness, and they never, actually this loneliness is a very, very harmful, as she said. It's like smoking 50 cigarettes per day. And obviously it leads to suicidal sometimes, like my colleague said, many of them, they commit suicide even because of this loneliness. So the best option for us to always be connected with people and be connected with your friends, even though there are always policies or there nursing homes there and community helps are there, for sure, we have to get connected with our families, with their friends, very importantly with our church. So the church communities always help you. So I do appreciate our senior elders to be connected with like the families, the church, and the friends, whosoever, and they continue to do what they are doing. So I think that is, sorry for taking time. Thank you.
No, thank you so much for sharing. Awesome. So my very last question goes to you, Dr. Alivato. Again, share your viewpoint with us on loneliness and its impacts to senior health, and also talk with us about specific programs like telehealth initiatives or technological tools that you believe hold premise in combating senior isolation.
Perfect. First of all, I believe that loneliness is much more than just a state of feeling in isolation and I'm going to talk about from the perspective of a healthcare provider. You know, I'm a physician that has been managed populations of millions of patients in all my years working as a doctor. So loneliness is a public health issue. It needs to be addressed because when we look at utilization and we look at emergency department utilization, you're going to see that those patients that end up at the ED, the risk factor that originated all that was basically in loneliness. Some patients, they go to the ED because they are alone. They don't know what to do. They start having anxiety attacks, and I think I'm feeling chest pain. I think I'm short of breath. And they end up at the ED with completely normal workups. And what is that? The physicians say, you know, all your tests are normal, you go home, and that is a revolving thing, because then they become what we call in utilization management frequent ED flyers, and they get labeled, and nobody's doing anything about it. You know, the physicians, and I heard many here saying, oh, I have only 15 minutes to see a patient. And there is so much more than we need to educate providers, because it's not the 15-minute slot that they have in their schedules at the office. It's the whole office staff, the whole clinical team, the patient-centered medical home approach that it's being so much advertised since NCQA and the American Academy of Family Physicians launched that concept. But are we really utilizing that? Loneliness is an assessment. You can pretty much ask questions. Are doctors, are nurses taking time to look at the patient's eyes and doing what they are supposed to do? I don't think so. You know, my experience, and now I just started being chief medical officer of an organization that is going from the transformation of fee-for-service to value-based. You know, they hate me already because I'm telling them, you need to know your patients. You need to do assessments. You are accountable for the health of those patients. You are accountable for what is going on in their home. We talk, and now I'm very happy that health plans are bringing social determinants of health as something that the doctor needs to address. It is important. Do I have food? And we talk a lot about food today, about food quality. Are we even asking our patients if they have money to buy food? What they have money to buy? Are we talking about housing security? My friend here is so worried about housing security. So all those factors, you know, they are getting into a utilization crisis in not only United States. I heard Germany talking. I heard, you know, Saudi Arabia talking. I heard all the countries talking here. And patients are the same regardless where they belong. So no, I'm not being so negative. I think we need to create a workforce and an awareness so that every doctor, you know, that has at least a person that has an MD after their name, take accountability. And it's a whole team, like nurses, social workers need to work together. So as long as I practice, as long as I'm here, I will fight so the patient has the correct approach. But what programs are? Let's be positive, correct? Let's be a little bit positive after I delivered my message here that I need all doctors to get this leave up and work. Well, we have several resources. You know, remember when Facebook came, Zoom meetings, and the pandemic really helped to engage resources because families were having online conferences. You know, they couldn't travel because if they could, they would meet their older members of the family, but they start having conference calls. FaceTime is wonderful. WhatsApp has a FaceTime, you know, feature. So from that, we start. But when we have a lonely patient, that patient went through something, and what resources can us, healthcare providers, plug in, or at least bring the awareness? So I made a little bit of list here, like Get Set Up. Get Set Up is it's a community in Facebook that they teach whatever you want to learn. You know, crafts, meditation, exercise, you name it. Some communities have like thousands of members. Some only have 31. I researched that. There is another, we were talking about AI today, and there is a device that is called, please, I'm not making any propaganda here. Yeah, I have to do that remark. Is LEQ. LEQ, I started researching because as I'm also a geriatrician, okay? So in 1984, I finished my geriatric specialization. So I'm all for the elderly, and most of the elderly, they live alone or nobody has time for them. So this is something that looks like a device, looks like a lamp with a tablet, and they do have, it's a companion. The difference between Alexa and Hey Google is that AI is proactive. So it does monitor the senior and sees when the senior wakes up and say, hey, good morning, you know, mister, how did you sleep today? And then, according to the setup, we can do a lot of the programs to help providers to manage those patients. We can do medication lists. We can include physical activity, goals of care. So you can have a plan of care there. And one of the features that I found it was extremely sweet is that the family uploads pictures, and then they can see the pictures, and the machine asks, tell me a little bit about that time when you were traveling with your kids when they were young. So then they start talking with the machine, they create essays, and this is an end-of-life tool. So when they're gone, the family has all those memories built. So there's a lot of resources, but I guess it's the mission of professionals like us to bring the awareness and to bring to the community, because I didn't know until I had to prepare this talk. You know, I was ignorant about it, and I had to prepare that. So there are other groups, including the Papas. We talked yesterday, someone mentioned that, which is to engage volunteers. It's a community, an application, a website. Then I volunteer my time to spend with seniors. So community is extremely important. Awareness is extremely important, and hopefully we can create more tools, AI, web-based conversations, tools to engage our elderly population, because I swear to God, we are all gonna get old here. Yeah. Okay, thank you.
I wanted to add too, managed care organizations and some insurance companies, they are recognizing the social detriments. And like right now, our organization have a contract with Elevated Health, that's an accountable insurance company, to make sure we're providing enough resources and connecting with our community, all ages, but we do monitor and have initiatives for our seniors. And I know Coordinated Care, that's in Washington State, they're providing contracts with grassroots organizations, community-based organizations, because they know that's boots on the ground in the community. So they are doing some things with that.
Amazing. Thank you very much, each and every one of you, for your amazing insights on this topic that does not get enough attention. I hope that each and every one of you will take the insights that you've learned today and take it back to your communities to create actionable approaches to combat senior loneliness. We have 30 seconds left.
Run.
I don't think the mic's working.
okay, so I'm going to project. Okay, so I'm also in the age tech space like you guys, and I love your talk. I could have listened to you talk for hours. And I'm a comedian. And I actually teach improv comedy to olders themselves. And it is one of the most beautiful expressions of finding a way to watch them connect as an antidote for loneliness. It's
Absolutely.
crazy. It's like Benjamin Buttoning everyone in the room. They lose 20 years, they get taller, they're smiling, and they connect. And it's a long term. So if you're doing it, please do it more. And meet me in the bar, we can talk about it. But like improv as a tool for anti-aging and fighting loneliness, I love it.
Thank you.
Thank you.
Thank you.
Thank you.